Do you ever ask yourself, does this patient have subungual exostosis? It's really quite common and really underdiagnosed. And so we're going to talk a little bit more about sort of what you might be seeing and how to really get a better understanding of whether it might be a subungual exostosis. Typically, when you're visually looking at it, there might be a hyperextended toe with a little bit of a dystrophic nail. There might be an ingrown toenail there, but things don't necessarily add up for it just being an ingrown toenail. And that's a real clear sign to say, okay, let's do a little bit more of an assessment or looking at that clinical history. Typically, there'll be pain or discomfort when in shoes, and typically as that toe is really kicking up against the top of the shoe as well, which is going to be causing that pain. Again, extended walking is going to exacerbate that just that little bit more and could be described as sharp, aching or throbbing in nature, which typically settles down when there's no pressure on the toe. But sometimes, again, patients will say that overnight the sheets can cause some of this pain, but you know, that's quite similar when it comes to ingrown toenails as well. For yourself, doing a clinical assessment, push on the tip of that toe to really get a good idea. If you're feeling a hard mass, then it's more likely that there could be some osseous changes underneath that could indicate that there's a subungual exostosis. Again, this is not pressing on the sides of the nails where it's more likely ingrown toenail, but you're going to get a really good idea. Once you've got a bit of a thinking of that it could be a subungual exostosis, send for that lateral x-ray with an isolated view of the hallux, and you're going to be able to see that ski jump potentially, or there might be a few other different changes there as well, right at the distal phalanx. Hopefully this has given you a little bit of further information about that subungual exostosis, how to potentially identify it. If you've liked what you've seen here, hit the subscribe button or check out some of our other videos around this and other conditions as well. Cheers.